Valerie's son Jacob was adopted at 18 months old, and he's now 18. I'm sorry, he's now 3 years old. Prior to being adopted, he was living with what was thought to be his biological father. And the biological father, from the mock client that we're making up, he didn't really provide any consistency. He worked long hours, and he had somebody coming in and out, providing very limited care to this child. From what we made up is that he was actually in an activity center stand and wasn't able to really learn how to walk as a 9-month-old or a year-old child would be able to. He had very minimum interaction, very little. So he had very little speech ability, very little ability to gesture, and so what's been going on, what Valerie's been telling me about, is when she drops him off at the school, he's been having quite a hard time. And the school has been complaining about his moods and his problems with separation anxiety. And I feel that I wanted to talk to Valerie because I think that because of the severe neglect that her son had, I think he might have experienced trauma. She had shared with me that when she got him, that they thought he was severely autistic because he was severely neglected. So I'm going to go ahead and start. So Valerie, I wanted to talk to you a little bit about your son Jacob and some of the things that he experienced in his childhood may have caused him trauma. Your son was severely neglected, according to the records, and was not taken care of in the way that you take care of him.
Oh, okay.
And you know, the thing what I notice when I come into your house, I notice that you're very loving, you're very attuned to him. You look at him when he needs help, and you pick him up or you hug him. You get him juice. You make sure he goes to the bathroom, but you're really aware of what he's asking you, and so that gives him a feeling of security and a feeling of safety.
Okay.
Yeah. And then I guess I wonder if when he goes to school, he just feels like that feeling of safety might not really be present. He might feel like, I don't know if my mom's going to come back, because when he was cared for before, so he never knew when somebody was going to come and clean him and feed him. So it's going to take him a little while to adjust to the fact that he knows he can trust you. He knows he's going to be taken care of.
Okay.
I remember too that that you were talking to me about how sometimes he does things that he acts a lot younger than he really is developmentally. So that's pretty common with trauma.
Oh, okay.
Yeah. So he might feel, it might feel like feel like you're babying him, and you're really not. You're providing him exactly what he needs at that time. So he's able to learn that skill and get that love that he never got as a child. So you're doing a really great job with really trying to help him with that.
So even though he was so young before, it would have still had an impact on him?
Yeah, that's the thing about trauma. They've done a lot of studies on it, and it can really make an imprint on the brain, and it can cause somebody to have, effects in every aspects of their life, effects physically, emotionally, and some of the kids that have, you know, dealt with this type of trauma, they may have problems like with moodiness, just because sometimes they just not are able to express themselves. So the best way they can do that is by maybe, acting up or being overly clingy or crying. And I know that some of those things that you have experienced that, with Jacob.
Yeah. So, is he ever going to be able to recover from this trauma?
I feel that, like, if you're able to meet his needs at the level that he needs, and if you continue to provide him the support, and it's possible when he gets a little older, when he's able to express himself a little bit more, he might really benefit from some special care, some therapeutic services, whatever he's needing help to catch up with. Like, if it's more speech, he might really benefit from getting speech therapy, because he may not be able to express his feelings as well.
Okay.
And so, or he might, just have to be more integrated with himself with his sensory, like if he had a sensory impairment or something. But there's just a lot of things that, as you, pick up things which you do every day. Like, I can see that you watch and you're careful and you're trying to figure out what's best for him. Like, I think that with the school and with having, if at one time he continued with getting in-home therapy services like he's getting now, some of these things will really diminish. And I think that over time he'll be able to, be at the point where he won't need any help.
Okay.
Once he feels more secure and he feels safe.
Okay. Good. I'm glad to hear that. I was really concerned that I was doing something wrong and he wasn't going to develop the way he should.
Yeah, no, you're doing exactly the right thing. You're providing him all the things that he didn't receive before. So you're doing a wonderful job. Just keep up the good work.
Okay. All right, great. Thank you.
You're welcome.
All right, so now we're going to go ahead and switch roles, and I'll be the therapist and Joanna will be the client. I'll be doing a very similar scenario, focusing on a young child who's like 5 years old and starting school now. Joanna is the foster mother of him, and he is experiencing some speech delays, and was delayed in his early development as far as walking and potty training and things like that. He's also showing some like attachment issues, separation, and just like struggling kind of in all developmental domains. Okay, so Joanna, can you tell me a little bit about Bobby and what you've been seeing since he started school?
He's been having a lot of issues where he'll tantrum and he'll throw himself to the ground, and he just doesn't like really interact with the other kids. He just seems like he has a lot of anxiety.
Oh, okay. So I know, we talked a little bit about this before, how he's your foster son, so he's been in a few placements prior to residing with you.
Mm-hmm.
And so what happens is those early stages of life, those early years, in the first year or two of a child's life are like the most crucial for brain development. So, when we grow up in a healthy and safe environment and we have strong, productive interactions with our caregiver, that's how our brain grows and all the different neurons in our brain develop. And we learn how to speak and communicate, and our fine motor skills develop and our gross motor skills, and we begin to walk and things like that. And so the problem here with Bobby is that because he was in so many different placements, he was never fully able to gain that strong attachment that you would expect a young child to have. Unfortunately, and this trauma experience ends up showing in these delays in his development. So now, and I know you were saying before how he's not speaking fully, and he has some struggles with his fine motor skills, holding his pencil and stuff when he's writing in school. So these are some things that are a result of because he never had those strong interactions with a caregiver. He never built that strong bond. So like I said, those early years are the most crucial for building that. But now that you're aware and you can see the impact that those early years have had on him, you can begin and continue to do what you're doing, meeting his needs, and helping him kind of, progress in the way that you would like to see. So it might take a little more work and a little more, just awareness to what he needs. But, just something to be aware of, that all of these things that you're seeing and that you're reporting. And, I think you had mentioned before that even as a baby, he wasn't crawling and walking as you expected him to. So all of those things are just kind of a side effect of the neglect that he had experienced being in so many different placements. Does that make sense?
Yeah, it does.
Okay. And so what happens ultimately is, when with the lack of being aware of it and the lack of the nurturing and the attachment, children grow up to have a lack of resiliency and struggle with making sense of the stress in their lives and processing their life experiences. So the trauma and the neglect that he experienced as a young child can ultimately have long-term effects. But because you've been so aware of it and so in tune with how he's not meeting the milestones that you would expect, you're actually minimizing the long-term effects, which is fantastic. And that's exactly what we want to say. But something else to keep in mind is that as he gets older and reaches adolescence and adulthood, that you might see some other disturbances or some other diagnoses that could arise, such as anxiety or depression, maybe substance use issues or PTSD symptoms as he gets older. So something to still kind of be aware of as he reaches those later years. But I think, in the meantime, just continue to do what you do, and if you notice, he's 5 now, so if you notice him crawling around on the floor or acting like a 2 or 3-year-old, sometimes it's okay to go with that and allow him to explore those younger years. Because what happens with neglect is they didn't get that nurturing that you would expect them to have as a young infant or baby. So they regress and they start acting like that young child. And oftentimes, we want to say like act your age or like, But
Yeah.
it's okay to let him explore being that age.